Colleague. I'd like to take my time to talk about the critical issue of health care reform as this body stands at a historic crossroads on this national challenge. We've never seen anything like the issues facing our country right now. The line between private businesses and public government has never been so blurred. Just look at this chart here. Government effectively owns several of our nation's institutions: insurance companies, financial institutions, banks, insurance companies, and automobile manufacturers. CEOs have been fired by government bureaucrats, and Washington is now in the business of dictating salaries in the private sector. With government takeovers on the rise, drastic labor law changes being pushed forward, and sweeping new corporate taxes circling overhead, we are truly moving towards a European-style government at a time when most European countries are moving away from it. I deliver these remarks with a heavy heart because what could have been a strong bipartisan bill reflecting our collective and genuine desire for responsible health care reform on 1/6 of the American economy continues to be an extremely partisan exercise pushing for more federal spending, bigger government, and higher taxes as a flawed solution. At the outset, let me make one point as clearly as possible. We are all for reform, everybody on this floor. Every Republican colleague that I've talked to wants to reform our current health care system. Ensuring access to affordable and quality health care for every American is not a Republican, nor is it a Democrat issue or idea. It is an American issue. Our nation expects us to solve this challenge in an open, honest, and responsible manner. Clearly, health care spending continues to grow too fast. This year will mark the largest ever one-year jump in health care's share of our GDP, a full percentage point to 17.6%. Growing health care costs translate directly into higher coverage costs. Since the last decade, the cost of health coverage has increased by 120%. 3 times the growth of inflation and 4 times the growth of wages. Rising costs is the primary driver behind why we continue to see a rising number of uninsured in our country, and why increasing numbers of businesses find it hard to compete in a global market. Without addressing this central problem, we cannot have a real and sustainable health care reform bill. Unfortunately, the Senate health bill, according to the nonpartisan Congressional Budget Office, will actually increase federal spending by $160 billion in the next 10 years instead of lowering it. Mr. President, you heard me right. It will increase spending. After the rush stimulus bill, Americans are rightly concerned about what is being pushed through this Democratic Congress. The rush to pass something that will affect every American life and business has raised concerns all around our nation. In a recent Gallup poll, a majority of Americans believed that their health care costs could actually get worse under the Democratic health care plans. So, why are Americans so skeptical and concerned? Because they are being promised the impossible. They're being told that this $1 trillion addition of taxpayer dollars to our health care system will actually preserve their current benefits, not raise their taxes, nor will it reduce the federal deficit. Even David Copperfield would be hard-pressed to pull this trick off. Many Americans recently had a first-hand encounter with the efficiency of the federal government in administering the H1N1 vaccination around the country. Their experience consisted of standing in long lines for several hours in sterile government buildings, only to be told that they were suddenly out of doses. Republicans in Congress agree with the majority of Americans who believe that just throwing more hard-earned taxpayer dollars at a problem will not deliver meaningful reform. Simply telling the American people that the solution for solving a $2 trillion health care system is to simply spend another $2.5 trillion, it just doesn't make sense. With nearly $500 billion in new taxes, this big stack of papers is a textbook example of the liberal tax and spend philosophy. Now compare that with the Constitution of the United States. This contains the most, and plus a lot of other details, this contains the whole Constitution of the United States. And yet we've got to have a health care bill that is 2,024 pages long. I mean, come on. It's an example of the liberal tax and spend philosophy that we see around here. Now, here are some of the highlights of that, of this piece of equipment, this bill, this massive, massive bill. I can hardly lift the darn thing. $28 billion in new taxes on employers through a mandate that will disproportionately affect low-income Americans, and all at the time when our unemployment rate stands at an unacceptable 10.2%. $8 billion in new taxes on Americans who fail to buy a Washington-defined level of health care coverage. $372 billion in new taxes on everything from insurance premiums to prescription drugs to hearing devices and wheelchairs, all of which are going to be passed on to the consumers, most all of whom are earning less than $200,000 a year. Like I said, there is no such thing as a free lunch, especially when Washington is inviting you over. Representatives from both the Congressional Budget Office, the CBO, and the Joint Committee on Taxation, JCT, have testified before the Finance Committee that these taxes will be passed on to the consumers. That's you and me. That's you and me and every other constituent in this country. So even though the bill tries to hide these costs as indirect taxes, average Americans who purchase health plans, use prescription drugs, and buy medical devices, everything from hearing aids to crutches, will end up footing the bill. By the way, we all know when this bill is fully implemented, it will cost significantly more. Every time Washington tells you that something will cost $10, you can count on it costing $10. History is prologue. Medicare started off as a $65 million, now notice with an M, $1 million a year budget, and now has a $400 billion budget. So look for these taxes to only go up in the future, as we've just given the federal government a whole new checkbook if we pass this bill. Let me also talk a little bit about the myth of health care reform and this proposal actually reducing the deficit. Here's the harsh reality. The Congressional Budget Office recently reported that our national deficit for fiscal year 2009 alone was a shocking $1.4 trillion. Now let me put this in perspective. We have exploding deficits. In 2008, it was $459 billion, the last year of the Bush administration. In the first year of the Obama administration, it's $1.4 trillion. That's the highest since 1945. It's more than 3 times our deficit from last year and almost 10% of the entire economy. This is the largest yearly deficit since 1945. This should send shivers down the spine of every American out there. We are literally drowning this nation and the future of this nation in a sea of red ink. The biggest bait and switch on the American people about the bill's impact on the deficit is a simple math trick. If something is expensive to do for a full 10 years or a full 10-year period, just do it for 5 years. And call it 10 years. Most of the major spending provisions of the bill do not go into effect until 2014 or even later, coincidentally after the 2012 presidential elections. So what we are seeing is not a full 10-year score, but rather a 5 to 6 year score. Now, chart 3. This is the real cost of the Senate plan. The CBO score, because it only scores really basically 5 or 6 years, because they don't even have it implemented until 2014 and in some respects up to 2015, they claim is only $849 billion or less than $1 trillion. Now, but the full 10-year score in the preliminary analysis of the CBO, the Congressional Budget Office, fully implemented, if you do it for 10 years, it's $2.5 trillion. Now, the House bill is even at a more astonishing level of $3 trillion. Now, let me go to chart 4 here, because in our current fiscal environment, where the government will have to borrow nearly 43 cents of every dollar we spend, or every dollar it spends this year, let's think hard about what we're doing to our country and our future generations. For months, I've been pushing for a fiscally responsible and step-by-step proposal that recognizes our current need for spending restraint while starting us down and on a path to sustainable health care reform. There are several areas of consensus that can form the basis for a sustainable, fiscally responsible, and bipartisan reform. These include reforming the health insurance market for every American by making sure that no American is denied coverage simply based on a pre-existing condition. Protecting the coverage for almost 85% of Americans who already have coverage they like by making it more affordable. This means reducing costs by rewarding quality and coordinated care, by giving families more information on the cost and choices of their coverage and treatment options, by discouraging frivolous lawsuits, and by promoting prevention and wellness measures. We should give states flexibility to design their own unique approaches to health care reform in accordance with their own demographics. Utah is not New Jersey, and New Jersey is not Utah. Actually, what works in New York or New Jersey will most likely not work in New York or New Jersey, let alone Utah. And as we move forward on health care reform, it is important to recognize that every state has its own unique mix of demographics. And each state has developed its own institutions to address its challenges, and each has its own successes. There is an enormous reservoir of expertise, experience, and field-tested reform out there. We should take advantage of that by placing states at the center of health care reform efforts so that they can use approaches that best reflect their needs and challenges. We should utilize the principle of federalism by having 50 state laboratories where we can look at the other states and see what works and what doesn't. Utah is a state where we have a tremendous health care system. It's rated one of the top 3 in this nation. Wouldn't other states be benefited by looking at the Utah system, or Minnesota? The Minnesota system is a very good system, according to what they tell me. We can learn from them. You could learn from all 50 states what to do and what not to do. Utah has taken important and aggressive steps towards sustainable health care reform. The current efforts to introduce a defined contribution health benefit system and implement the Utah Health Exchange are laudable accomplishments. And just like you, I strongly believe that a one-size-fits-all Washington solution is not the right approach. We should empower small businesses and self-employed entrepreneurs, the job-creating engines and lifeblood of our economy, to buy affordable coverage by giving them the same purchasing advantages as the large companies. Unfortunately, the path we're taking in Washington right now is simply spend another $2.5 trillion of taxpayer money to further expand the role of the federal government. Now, Republicans want to sit down and write a bill together to achieve sustainable reform that we can all afford. We do not believe in the our way or the highway approach on an issue that will affect every American life and every American business. Republicans have put forth ideas both comprehensive and incremental through this health care reform debate, especially during committee considerations. These ideas were either summarily rejected on party line votes or simply stripped out in the dark of the night before the final version was released, and this version is no exception. This version was done in the back rooms of the Capitol with the White House and just very few senators cobbling together what they thought would be a compromise between the HELP bill and the Finance Committee bill, and maybe even with some consideration to the House bill. There was no real bipartisan work on this bill. There was no real attempt to try and bring people together. It was just strictly a partisan bill, as have been the HELP Committee bill, primarily the Finance Committee bill, and above all, the House bill. I'm especially disappointed that the President and the Democratic leadership in the House and the Senate have chosen to pursue the creation of a new government-run plan, one of the most divisive issues in health care reform, rather than focusing on broad areas of compromise that can lead us towards bipartisan health care reform legislation. At a time when major government programs like Medicare and Medicaid are already on a path to fiscal insolvency, creating a brand new government program will only worsen our long-term financial outlook. To put this in perspective, as of this year, Medicare has a liability of almost $38 trillion, which in turn translates into a financial burden of more than $300,000 per American family over time. So what is Washington's solution to address this program in crisis? We'll take up to $500 billion out of this bankrupt program and use it to expand another bankrupt program, Medicaid, and create a brand new Washington-run plan. Washington government-run plan. Now, I'm not an economist, but I know that taking money out of one bankrupt program to create another is not a good idea. We should be reforming Medicare and Medicaid for our people, but instead we just keep spending. And to take $500 billion out of Medicare that has a $38 trillion unfunded liability, I think it's immoral. It's certainly not very economically sound. Well, I can keep going, but the point here is simple. Washington is not the answer. The impact of a new government program on families who currently have private insurance of their choice is also alarming. A recent study estimated that cost shifting from government payers already costs families with private insurance nearly $1,800 more per year. This is nothing more than another hidden government tax. Did y'all get that? Because Medicare pays doctors 20% less and pays hospitals 30% less and other providers even less. Those who have private health insurance have to pick up the costs. And it averages $1,800 per family program. Think about that. That's because government has been running those programs. Creating another government plan will further increase these costs on our families in Utah and across this country. Let me take a couple of minutes to talk about process. The Democratic leadership spent they took 6 weeks behind closed doors to write this bill. It's only fair to expect that we will at least have 72 hours, to review these 2,074, but it's 2,074 pages. This thing right here, this is the bill. My gosh, 2,074 pages. Tolstoy's War and Peace is only 740 pages. Oh. This is a bill. We ought to have at least 72 hours to review these 2,074 pages before beginning any Senate floor action. Well, we're going to vote on Saturday at 8 o'clock on whether or not we should proceed, but it won't be proceeding to this bill. It's going to be proceeding to a shell bill. And if they are able to proceed, then they will bring up a substitute bill, which will be the bill that they've worked on for 6 weeks in closed rooms. It'll be a shell bill that'll get it going. It's a shell game between you and me. One that's done right here in Washington by people who believe that the federal government is the last answer to everything. There's a bill that affects every American life and every American business. 2,074 pages is too big, and it's too important not to have full public review. In fact, I think 72 hours is ridiculous. We're talking about 1/6 of the American economy. To enact true health care reform, we have to come together as one to write a responsible bill for the American families who are faced with rising unemployment and out-of-control health care costs. Now, our national debt, it's ready to double. in the next 5 years. Look at that. It's ready, the red lines, that's the projected national debt under the current administration. That debt is projected to double in the next 5 years and triple in the next 10 years. Let me tell you who catches on to this. It's our friends over in China, to whom we owe $800 billion. Think about it. They're concerned about the devaluation of the federal dollar, of the American dollar, because they see us being profligate here in Washington. Let's slow down and think about what we're doing to our future generations. I think there's still time to press the reset button and write a bill together that every one of us can support and be proud of. And right now, Republicans aren't just standing in the way. We actually believe we could do a bipartisan bill if we had a chance, if we had real good faith effort by both sides. The Health Committee bill wasn't done that way. We did have markup in the Health Committee, and almost every substantive amendment was voted down on a party line vote. The same thing basically happened in the Finance Committee, although I have to say that the distinguished senator from Montana, the chairman of the Finance Committee, made every effort to try and bring people together. And I give him a lot of credit for it, but he was so severely restricted by his side that there was no way that people could support it. I was a member of the Gang of Seven, but I began to realize what the final bill was going to be. I couldn't support it. So I thought the honorable thing to do, instead of coming out of every one of our meetings and finding fault with it, with what they were talking about, was to leave the Gang of Seven. And I did that. I felt bad doing it because I wanted to help work on a bipartisan bill. But the distinguished chairman was so restricted by his side that there was no way that we could have a bipartisan bill out of that committee. And it's disappointing to me, as somebody who's worked on so many health care matters over the years, everything from Hatch-Waxman to the orphan drug bill to the CHIP bill, you can name it, that we didn't have the guts or the ability to sit down and work this thing out together. Now, we're getting sold a bill of goods here that really don't make sense. I mean, this is a travesty. It's a travesty. It's hard to believe that they think they can pawn this off on the American people. And my gosh. I know some of the folks who've done this are well-intentioned, and I love and appreciate them in many ways, but not for this stuff. I was going to say something else, but I want to be very kind here. Constitution? This is the whole Constitution. The most important document, political document in the history of the world. Plus, it's got a lot of interesting material in the back, plus an index and so forth. But that's it, right there. Here's what 1/6 of the American economy is going to be if we allow it to go forward. I personally believe we ought to kill this bill, and then we ought to sit down and work it out together. And if there was a real bona fide attempt to do that, I have no doubt we could do it. We've done it in the past. One of the things that I found most disappointing is that the polls show that 85% of the people who have insurance are relatively happy with it. Yes, they'd like premiums to go down. They'd like to be able to have it even be better. But they're basically happy with their health care coverage. If you deduct the 6 million people who work for businesses that provide health insurance, but they don't take it, they'd rather have the money. You deduct the 11 million people who qualify for CHIP, the Child Health Insurance Program. That's a Hatch-Kennedy bill, by the way. And they qualify for Medicaid, too. If you deduct those 11 million people, and then you deduct the 9 million people who earn over $75,000 a year and can afford their own health insurance, and then you take away the illegal aliens and others in this country who who are part of this, it comes down to 7 to 15 million people who need health insurance. Think about that. We're going to throw out the whole system of health care that 85% of the people basically believe is worthwhile over, at the most, 15 million people that we could subsidize and help in a way that would be reasonable. And we're going to change our health care system from state-run systems and bring it right here to Washington, where a bunch of federal bureaucrats who are far removed from people in the states will determine every aspect of health care in our lives and run our health care system into the ground even further, like they have Medicare and Medicaid, without the appropriate reforms that really would keep those programs that could be great programs and are great programs in some ways going. Now, they'll say, well, aren't those government programs? Yeah, they are government programs, and they're both deeply in debt. Medicare goes into insolvency by 2017. Maybe it'll be as late as 2019, but it's probably 2017. Medicare the same way. What are we going to do? Saddle our young people for the rest of their lives with untold expenses? We're going to saddle them with this huge stack of paper? My gosh. No wonder we're in such deep financial difficulties in this country. If we're going to rely on the federal government to solve our problems, we're making the most tragic mistake we possibly can. But the federal government could participate, but let me tell you, if we'd work on a bipartisan bill, and let me make one last point. If you have a bill that affects 1/6 of the American economy, and whatever passes here, if it does, will be a bill that will be concerned with 1/6 of our American economy. If you have a bill that's that important, and you can't get 75 or 80 votes in the United States Senate, you know that's a doggone lousy bill. And you know that it's a partisan bill. And you know it hasn't been well thought out. And you know that it's one-sided. And you know that it's going to cause an uproar throughout this country like it's never been seen before. It already is. And you know it won't work. And yet we're going to saddle this country with this monstrosity. I've got to tell you, I can't hardly believe it. I can't hardly lift it. And I'm not exactly weak. All I can say is that that's a huge monstrosity. Think of the Constitution. There's the whole Constitution right there. And yet we've got to have a health care bill this big. Well, I'm really concerned about it, as you can see, and I'm worked up about it, because there are some of us who would really like to work together and do a bipartisan bill, but let's be honest about it, there hasn't been any chance to do it. And this bill in particular has been worked out in the back rooms between the White House and very few senators, and without any input from our side at all. And frankly, ignoring much of the good things that have been expressed on our side. Mr. President, I hope that we'll think this through. I hope we won't pass this. And then I hope that we can sit down and really do a bill that will work, that will not eat this country alive. I yield the floor.